And now to this, and potentially some very hopeful news. On Wednesday evening, President Ramaphosa said he would be addressing the nation next week. With COVID-19 infections and deaths on the decline and clear calls from the tourism industry that an announcement on opening our borders to international tourists must be made within 7 days, there is much hope that the President will move us to lockdown level 1. As we know, of course, always there's got to be great consultation before every levelling up under lockdown. Let's start now with a medical focus on the virus, and I'm joined by Dr. Karen Begg, a public health specialist with UCT's Faculty of Health Sciences. Good evening, Doctor. So what are the medical indicators that you would look for that suggest a virus is pretty much under control?
Thanks very much, Sally, and a warm welcome to everybody. So it's been an amazing piece of history as we've had these last few months of watching an epidemic come and start to wane. So that's what's been very encouraging. So we're sitting currently at around 8.5% of active cases. So whilst our case numbers are significant at around just under 650,000 now, we've dropped from being 5th in the world to 8th in the world. We're only sitting at around 8.5 active cases at the moment. Our deaths are concerning because although we have around 15,000 reported deaths, our excess deaths probably give us a better idea of the impact of COVID. Sits at around 40,000 based on the South African Medical Research Council data. But we do see from the tracks and the trends that our peak for the country was around mid-July. The Western Cape was probably mid to the end of June. And that's looking at both cases, active cases, deaths, and excess deaths. All of those curves are looking like we're on the significant downward trend. What's also incredibly encouraging was the study in Cape Town metropolitan area that was released, I think it was last week, which is that around 40% of the sample that was taken showed antibodies for COVID-19. So that's 40% of the sample. Whilst there are always limitations to generalizability based on sampling and the sample size, it is encouraging that in fact we may have had more infections. We always knew we had more infections than we were testing for, but it certainly appears that our susceptible population, that in fact more have had COVID than we previously realized and have some degree of immunity. Of course, we don't know yet, because it's a new epidemic, how long that immunity lasts. But it's certainly, there are a number of hopeful signs at the moment around the epidemic.
What about the ratio of positive tests? I know that we're testing less because less people are presenting with symptoms, but apparently the golden figure is you want 10% or less of however many tests you do to be positive. Is that the 8% you were referring to, or is that a different thing?
No, so the 8% I was referring to is the number of active cases. So we have about 56,000 active cases currently. In other words, those that are currently infected and therefore infectious. Versus those who have already recovered. But you're quite right. The number of the testing ratio in terms of positive tests versus number of tests done is really important. So at one point in the Western Cape, we were around up to about 50 to 60% of all tests that were done were positive. We're now down to 9.8% as a 7-day average for the country. So that's also looking really encouraging. And even that tests per day and positive cases per day is also showing the same trend of having peaked and then coming down side. So that's really encouraging.
All indicators, so all indicators looking good. Are we ready for level 1, which we know probably means opening up our borders to international tourists?
Yeah, so level 1, I think, we'll have to depend, because initially the level 1 criteria was that it would be fairly open travel, fairly open accommodation, but actually that our borders may still have some restrictions. So I think we'll have to wait to see what the devil in the detail is when level 1 lockdown is released. But certainly that would be a significant challenge for us. We know that this is a disease of movement. In terms of humans give the disease movement by giving it legs and transmitting from person to person. We know that it's a disease of metros, which is about densely populated areas. And so as soon as we start going soft on physical distancing, more likely than, for instance, some of our sanitization and other measures, physical distancing is really one of the key issues. So any congregation of people, whether it be on events, whether it is through connecting people from different areas and moving the virus from, for instance, between provinces. So right now we can move between provinces, but there isn't a lot of movement between provinces because we aren't allowing events and things like that. And of course, international travel. So, you know, the government is in that difficult space of having to play the tension between the economy and the epidemic. And so it just needs to be done very cautiously and take it slowly. Because at the moment, you know, we are mixing in an environment, in a population wherein we do seem to have a relatively high proportion who have had the disease, not known it, and hopefully have some immunity now, but we don't know how long that immunity lasts.
Absolutely. Thank you very much, Dr. Karen Begg. She's a public health specialist with UCT.